Hello friends, this is a reasoning question on the digestive tract and a very simple one. So let's see what the question is. Complex carbohydrates or cellulose or starches, they relieve constipation. If you consume them in the diet, they relieve constipation. Explain why. Let's understand what is constipation first. Look, the stools or the fecal matter is that undigested food stuff which is eliminated into the feces by defecation. And what is constipation? It is reduced bowel movements. If the colonic movements of the large intestine, colon, the movements are reduced and defecation occurs with a less frequency, like less than 3 per week. See, normal frequency should be at least once per day. So it should be 7 times per week. If it is less than 3 times per week, and plus the stools are very dry and hard and difficult to pass, there is pain while passing the stools, then that's defined as constipation. So remember, what is stools or fecal matter? It's the undigested foodstuffs. From the foodstuffs that you have consumed, the undigested part is excreted as fecal matter. But if it is with a reduced frequency and a very dry, hard stools or fecal matter, it's called constipation. And therefore, to relieve the constipation, the idea would be to increase the movements of the colon. How does that happen? Look, when there is bulk of the fecal matter or bulk of the stools, they would stretch some segment of the colon. It would initiate the reflex motility of the colon, large intestine, and with increased intestinal motility, there would be defecation reflex, and that is how the fecal matter is passed in the defecation. Now, suppose the foods are easily digestible. What will happen? They will be digested easily from the upper small intestine, and most of the nutrients will be absorbed from the small intestine. So very less would reach the colon actually. And if very less foodstuffs reach the colon, making a very small fecal matter, then it would not be able to stretch the colonic segment, and therefore it would not initiate the defecation reflex. That is when constipation is likely to occur. So with that in mind, let's understand how the starches or undigestible carbohydrates, they relieve constipation. They will, to relieve constipation, you need to increase the bowel movements, or rather bowel movements or colon movements need to increase. And how does that happen? By increasing the bulk of the stools. Bulk increased means it will stretch the colonic segment, and that would initiate the movements of the colon, the reflex movements, and defecation reflex will be initiated. And also stools should be softened up. All this is achieved by the undigestible carbohydrates or undigestible starches. Those complex carbohydrates in the diet, in the form of the skin of certain fruits like apple skin or certain green leafy vegetables, they are fiber rich foodstuffs. So when you consume them, they remain undigested. It's not easy for our intestinal juices to digest them easily. So they will remain undigested, commonly called as roughage in the diet. If you have heard of this word, they are also called as roughage in the diet. So fiber rich content. Now this will remain undigested and it will reach the colon. Now because of that, it will increase the bulk of the contents in the colon. And as we saw, if the bulk of the colonic content is more, then it will initiate the movements of the colon, and it will result in the defecation reflex. So it will increase the frequency of defecation. Plus, some of them, they can also pull some water by osmosis, and this will also soften up the stools. So all in all, it will increase the colon movements, it will initiate the defecation reflex, frequency of defecation will increase, and the constipation will be relieved. So that was the reasoning question in this particular video.